The advances that have been made in cancer research continue to increase, but how do those advances translate to the average American? Here to discuss cancer prevention is Dr. Mohit Narang of Maryland Oncology, Hematology. Thank you, doctor, so much for joining us.
Thank you.
Let's talk about how we can reduce our risks from colon cancer.
Colon cancer is the third commonest cancer worldwide. There are many reasons, the risks for colon cancer. One of the common is being diabetic. Patients who are at history of diabetes mellitus, they have a high risk to develop colon cancer. Second is high alcohol intake, which means more than 4 drinks a day. That's another big risk factor for colon cancer. Eating a lot of red meat, that's also a risk factor. So current recommendation is decreasing your red meat intake, 1. 2, increasing your fruit and fiber intake has shown to decrease your odds of getting less of colon cancer. Other thing is the decreased vitamin D levels, especially seen in females, has also been shown to cause increased risk of colon cancer. So vitamin D levels should be recommended to be checked. If they are low, vitamin D intake should be done.
And that would be just from a supplement?
Yes.
Yeah. What are the current guidelines as far as the screening for colon cancer?
Current recommendation is to do colonoscopy once every 10 years. Also, that's an invasive test, though. If it's a non-invasive test, we recommend checking your stool for blood once a year. The only thing with that is it can have a high risk for having falsely positive results.
And what age would you begin?
As per American Cancer Society, they recommend at the age of 50 or above.
Okay. Now, moving over to lung cancer, there's been a huge announcement made as far as the screening guidelines. Can you tell me about that?
Sure. As per NCCN, which basically National Comprehensive Cancer Network, from which we follow the other guidelines, there was a huge trial done in which they randomized half the patients to no CAT scans, other one, they did get low-dose CAT scans. It was seen for people who were 30-pack smoking history, or people who had smoked that much, but they're above 15 years, they had not had any tobacco smoking. Doing an yearly CAT scan did show that it decreases the mortality from dying from the lung cancer.
So if you've been smoking for 30 years, or you've been a heavy smoker for a long period of time, you are now eligible for this screening, which could save your life.
Certainly. It will also detect a cancer at earlier stage, highly curable at that time.
And what are the screening guidelines for lung cancer now? What's the process? At one time, we also recommend PA lateral chest X-ray. Currently, they are not recommended. So CAT scan, low-dose CAT scan, I should say, doing it once a year. So basically, the bottom line here in the common thread is lead an active life, a healthy life, and everything seems to be in moderation. It used to be have more red meat in your diet because it's good for you. Now it's not too much. So everything seems to be in moderation.
You're absolutely right. Red meat is no-no, especially for colon cancer and for other things, but for colon cancer, no-no. Similarly, fiber and fruits and vegetables have also shown to decrease your odds of dying from a colon cancer.
All right, doctor. Great information. Thank you. Get all your questions answered about cancer detection and prevention by Maryland Oncology Hematology. Contact them at 410-964-2212 or online at mdonc.com. When you're